everybody. Karen Roby here with Macy Barron and Veronica Combs for TechRepublic, talking today about how we're all adjusting to this new way of working from home and adjusting to new things all around. One of the things that people are used to doing that we're seeing a big change in is how we handle our healthcare, of course, and going to see a doctor. It's just not as easy as it used to be as we're concerned about being in group settings and things like that. So one of the things that's really emerging here is telemedicine. Veronica, I know you put together some great articles here as far as what is available to people, how they can still see and talk to their doctor when they're in need, obviously not when they're in an emergency setting, but talk a little bit about some of the resources that you've found and have been writing about and how that can really help people at this time.
Sure. I mean, I think people always consider the gold standard is like a visit with your doctor. Like, I'm looking at you, you're looking at me, you can tell, my health. But now it's really flipped around that, you don't really want to leave your house if you don't have to, and doctors don't really want you breathing on them if you don't have to. So some of the more, I would say more hospital and health systems on the coast were faster to have these telemedicine platforms. So sometimes it's a chatbot and you just type in answers to questions and they'll sort of run you through the symptoms. Sometimes it will be a nurse practitioner and you can log on, make an appointment, download the software, log on, talk to someone. One of these stories that I wrote about this week, which was really interesting, was Johns Hopkins Medicine is working with a company called eMocha Digital Health. And they're actually working with hospital workers to screen them for COVID-19 and screen their symptoms. So it's actually called asynchronous video chats. So basically it's an app. You answer some questions. Do you have a fever? How are you feeling? And then you record a quick video and you submit that. And so the company, the digital health company, certainly looks at your answers to your questions, but the president of the company was saying sometimes the answers to the questions are different from what a person says on video. So maybe you get a more honest recount of symptoms or how you feeling or whatever. So, there's options for people who are just worried about symptoms. There's options for people who actually need to talk to someone. And now they're screening healthcare workers, thank goodness, because, without doctors and nurses and physicians' assistants, we'll all be in real trouble.
Yeah, well, definitely. That's the scary thing too, right? When we talk about, the long-term effects, and if the healthcare workers, those on the front line, if they're getting sick, then it's a trickle down effect, having an impact on all of us. And one of the big facets of this, I think, Macy, and I know we've talked about this several times, is from a mental health standpoint, not only are people used to going in to seeing their therapist on a regular basis, you have that, but you also have people that are now cooped up inside their house. They're scared. We have anxiety. We're concerned.
Totally.
This is an even bigger issue than ever before.
Oh, absolutely. And I've been doing a lot of research for months now for a cover story about telehealth resources, particularly for rural Americans. But in that research, I've also been learning a lot about the telemental health services that are just for everyone too, that are in big cities. And what I found is, some of the things that Veronica mentioned, a lot of the telehealth resources that we are familiar with and that are very common include like pharmacy services, chronic care management, even ICU tools. And the American Hospital Association goes into all of those things along on their website. But when it comes to mental health, the people haven't really been turning as much to telehealth for mental health for as long as they have for physical health needs. And what's really interesting is I think it took a lot of insurance companies longer to cover those sorts of things. And it took, I think, people longer to seek out those types of services, because I think that we can all agree there has been a lot of stigma surrounding mental health, obviously, and both a systemic and systematic stigma. And that has a trickle down effect, especially when it comes to, like I said, people seeking out these services. And that becomes even more difficult when you're cooped up at home. People can often use that as an excuse and say, oh, well, I was going to try to make the jump and go, but now I'm at home. So, but there are these websites, like a really popular one I found was called Talkspace. And I think even our company covers one or one similar to it, where you can just go online and get matched with either a nurse practitioner or with a therapist or a psychiatrist and have your services just like you and I are talking right now at home. And it makes it really easy, and it makes it, it almost helps to make it more comfortable, I think, for people that are worried about going out and having those meetings in person. So the whole quarantine situation might actually be helpful for people that are wanting to take the leap and start therapy, but it also makes it pretty easy for people to continue therapy that have already been doing so for a while.
Yeah, I hadn't thought about it from that standpoint, but you're right. If people are, nervous about seeing someone face to face, actually driving to an office and having to walk in for the first time can be a little bit overwhelming, I'm sure. Do you feel like, Macy, some of the things that you're reading, I mean, we're all scrolling through social media, of course, every day and reading the news and things. Do you feel like this is being addressed more? Are you hearing about it more?
Yes, and I think right now, particularly because of a lot of the uncertainty and chaos surrounding COVID-19, I think a lot of people, it's very anxiety inducing. I have a good friend of mine who's always struggled with anxiety, who has seen even heightened elevations of worry with everything going on, because it is a scary time. And so I think that a lot of self-care and mental health, at least I've seen through social media, has been amplified through all of this, because being cooped up at home, especially for people that struggle with depression and anxiety, can be really tough, because getting that social connection and getting outside and being with people is often something that people who struggle with these things need. And I read that a lot through my research, and with a lot of telehealth professionals that I've talked with. But the good thing with telehealth technology is that it can bring back some of that connection, and it can establish some of those social aspects that are necessary for people that struggle with those things. So I think there's a lot of good aspects of that. Veronica, in your research, have you seen anything really that has to do with mental health, or have you seen more of the physical health side of it?
Well, lots of entrepreneurs focus on something specific, like people with diabetes or transplant patients or something. Some health conditions need a lot more support and attention than others do. Emoca Health, the company I mentioned before, they actually started with tuberculosis patients, because you have to take a drug every day for 7 months. And so they were doing these asynchronous video check-ins with tuberculosis patients and public health workers. So you could actually prove, yes, I am taking my medicine at the time I'm supposed to take it every day. And so I think from a healthcare provider point of view, it's really given them more capacity, because if you call, you can't get in, right? There's no way hospitals or doctor's office could answer 40,000 calls a day to answer questions about COVID-19. So I think these tools that maybe some doctors are like, maybe not, they see that they can help a lot more people, and they can sort of find the right fit. Maybe it's a text back and forth. Maybe it's a video check-in. Maybe it's just a chat bot answering your questions. They call them worried well, people who are sure they've caught every latest disease that comes down the pike. So I think from a doctor point of view, it helps with volume, it helps reach more people, and it helps the doctor and nurses spend their time on the people who really need attention. So finding the right level of support, that's what I've seen with mental health, but also just, dealing with the volume of questions that people have.
Totally.
Yeah, and thank goodness, at a time right now for social media. I know, like you mentioned, Macy, that with rural communities, and often people don't know the resources available to them. It seems like that the healthcare companies, the insurance companies, the providers are really starting to push the message out there, of what's available to them on the mental side, as well as, for every other thing too.
Totally. And even before the coronavirus outbreak and craze, there were already services being offered to rural communities and already progress being made there. Because when I started doing this research for the cover story, it was before all this happened. And what was really interesting was that universities were playing a huge role in bringing telemental health services to rural communities, which I thought was really, really interesting, because a lot of hospitals offer all hospitals offer mental health services, but that's really difficult for people that live in these outer areas where the commute is really difficult, or, like Veronica mentioned, the availability isn't great. But what universities are doing are their medical schools, they have their psychiatry residents partnering with clinics in these rural areas to offer services and to both train the residents and also bring that availability to the rural areas. So just the regular mom and pop clinics in rural areas are finally being able to offer services to people that live in those areas. And I feel like this is probably something that's even more critical right now, and maybe something that's even expanding to the physical health side. I don't know, but Veronica, have you seen anything interesting in regards to rural care in your research?
There's a hospital out in Utah called Intermountain, and they have a bunch of different clinics, and they really rely on telemedicine to reach some of the patients who live, on the other side of the mountain or 5 hours away, or there's no one there. And I think the other change that we've seen over the last few years is that now doctors can get paid for doing this work. Because before, maybe you had an early adopter who's like, I love video conferences, I love texting my patients, let's do that. But if they can't get paid for it, then how can they justify spending their time on it? And so one entrepreneur I talked to about 5 years ago, he was doing a telemedicine service, and he had to hire doctors who are licensed in every state. Because if you're in California, but the patient's in Colorado, you had to have a doctor certified to practice in that state. So now the government is catching up. They're making it much easier for people to practice telemedicine, to get paid for their time. And insurance companies are finally catching up too and saying, yes, we will cover mental health counseling over Skype or over FaceTime or whatever platform is secure.
I know Medicare definitely, I know covers it. And I mean, it varies by state on some regard, in regards to certain insurance companies, but I know most major insurance companies will cover telehealth services now, which I think is very indicative of where the industry itself is moving. I mean, especially during quarantines.
Well, and now that patients know this is possible, I think people there'll be a lot bigger push. Like, well, you did it before, why can't we keep doing it? Help me stay healthy.
Exactly.
Right, definitely. Well, I know one thing that certainly helps is, and we're all, of course, the three of us, in the same city, and having the sun. When we see the sun, and it's like you can get outside and finally get to, feel a little more normal and take a walk or walk the dog, it makes a big difference.
No, it really does. Even yesterday, it was not great weather in Kentucky, and it was raining, and it just made me feel even worse. It's like, not only have I been cooped up in the house all these days, but now I can't even go outside and just get a little bit of fresh air. So, I think that right now in particular, with both physical and mental health, those telecommunication services are even more instrumental.
A lot of telemedicine or digital health companies talk about nudges, like, kind of like your Apple Watch tells you, well, you haven't completed your circles. So if maybe you need a nudge to go outside, or you need a nudge to record your mood, or you need, a reminder to take your medication. And so, these platforms can provide just a little bit of support, not a full-on doctor visit, but just a little help to tell you to get out and take a walk, or tell you to call your friend or your mom or your aunt or whoever you need to talk to that day, which is another big advantage of this kind of different way to practice medicine.
Yeah, and thank goodness for platforms like Zoom, so we can at least stay connected with each other and friends and family. It's been quite interesting to see people that aren't, really technologically savvy to try finally getting set up on things like this and getting it done. So it's very possible. Well, ladies, I certainly enjoyed it. This was great to get together and talk about it. And I know, Macy, you mentioned that cover story of yours will be out here shortly. Is that right?
It will be, hopefully, crossing fingers in the next week, if not probably 2 weeks max. So keep an eye out for it, definitely.
Yeah, great timing on that. And Veronica, I know you've published several articles related to telemedicine and outline, putting together some resources for people. So make sure all you guys check that out there on TechRepublic as well. Thanks for watching, everybody.